Welcome back, everyone. According to the CDC, among survivors of COVID-19, 1 in 5 continue to have symptoms.
Long COVID is a growing concern as so little is known about what causes it and how to treat it. We're getting answers as persisting symptoms can take a toll on a person's body, mind, and even livelihood. April 2020, the coronavirus invades the Amherst nursing home where Jody Pino-Chasen works. She's assigned to the COVID unit, doing FaceTime calls with families of those dying from the virus and delivering devastating news.
You just make that call and say, I'm sorry, your family member is gone, is probably one of the hardest conversations to have.
Soon, it was Pino-Chasen who would end up in a COVID unit as a patient, this time in the ICU.
And it was just a very scary situation, you know, and I'm sure it was very scary for the nursing staff, because then I would tell them that I caught it on a unit.
She had respiratory failure, double lung pneumonia, and was put on oxygen as she struggled to breathe. After 6 days, she was sent home in bad shape.
My wife had to help me shower. You know, I was just so weak. Palpitations, walking up and down stairs, out of breath.
And she's never fully recovered. The body aches, fatigue, and brain fog linger to this day.
I was thinking I'd be better, I'd be back to work, I'd be, you know, that kind of stuff. And I just didn't have the strength to be able to.
When her 12 weeks of medical leave ran out and after being denied part-time or remote work, she was fired. Dr. Jason Maley, an instructor at Harvard Medical School, says long COVID can be debilitating and job loss is often a side effect.
They may be exhausted during the day, and so they have trouble doing work at home or doing activities around the house. They can't multitask. Even just getting through comprehending emails or documents is difficult, and they have to keep rereading.
That and memory loss are symptoms that Pino-Chasen finds most troubling.
My brain just kind of stops, and I can't think of what the process.
Prior to the pandemic, Dr. Maley says this cognitive impairment had been described after other infections.
In people who had sepsis or people who were in the intensive care unit, I think what's striking is that we're seeing it in people who had no pre-existing cognitive issues and had mild viral infections.
He says cognitive rehab can help to recover some functions of the brain while teaching skills to help you stay on task and at work. Pino-Chasen has now opened her own counseling practice, but continues to struggle with bouts of extreme fatigue.
I think you always worry that it's going to get worse. And the tiredness is, and when it hits, it's a different type of tiredness. You know, people are like, oh, you're tired, work through it. It's just exhausting. It's like to your bones.
So often people describe feeling like they're weighed down, like they're carrying around the weight all day long.
Dr. Maley says there are some rehab and medication treatments, but number one is pacing the amount of energy you use.
Recognizing that actually pushing too hard can cause people to crash and feel the next day they're in bed and can't get up physically, or they're feeling sick or having achiness.
Pino-Chasen is doing just that, taking more breaks and fewer clients, but she sometimes wonders where she'd be if she never got COVID-19.
I would be able to take more clients in my practice. You know, I would have been able to wean out of that job and not have the income loss that I had.
Since getting long COVID, Pino-Chasen has been vaccinated and double boosted. Dr. Maley says about a third of patients with long COVID who get the vaccine see their symptoms improve, but the vast majority see no change, and even a small number of people see a worsening in their symptoms. Dr. Maley says there's hope on the horizon for those suffering from the effects of long COVID.
What we're really eager to get started are clinical trials, things that will test treatments.
He says in the second half of this year, clinical trials will begin on some of the treatments he's already been using in his clinic, as well as brand new ones.
We're hopeful that some of these new treatments and some of the ones we plan to test will prove effective and will really help people recover quickly.
And those clinical trials are part of a $1 billion study run by the National Institutes of Health called Recover to get answers on treating and preventing the effects of long COVID.